Hi, good evening. My name is Safo, and this is my video check-in for the week. From my practicum experience, I was in a meeting with other stakeholders of the nurse residency program in my facility, where I've been a member of the advisory council for the past 3 years. So we do have monthly meetings where we deliberate on any issues that the program director might want us to, have discussions on, whether it's related to compliance with accreditation or whether it's related to feedback from residents, whether it's related to preparedness for next cohort, whether it's in relation to preparedness for external auditors that are coming in. Whether it's curriculum development, whatever advice or whatever inputs that is needed from us, we do work as a committee or as a council to help our program director. We do have a very strong program. Our retention rate is 100% for the first 3 years, and that's the measure they use to check for the first 3 years how many residents are you retaining. And like I said, averagely we've had 100%, and we know there's a lot of evidence out there that shows that nursing students, when they graduate school, within the first 2 years they quit in their numbers from the first place they are working, or from some of them even from the profession itself. And so for our program to have that retention rate is something that is very impressive. And our program director, he's very good, and he's really helped establish a very good and rigorous program helping with retention in the facility. Now let me go to my DMP project. It's going on very steadily well. I did have a meeting with the leadership on the unit, and I did have a meeting with the charge nurses on the unit also. It was just about encouraging them to make sure this workflow process is being used the maximum that we can, as much as possible. With the staff, they have to go in there and use the dashboard, and most importantly, it's going to remind them to reassess this pain medication that they've administered the patient. And so they are using the dashboard, but I'm that person who wants us. Let's continue doing it. Let's go on. It's not adding any more work. It's actually helping you. You are getting to reassess the veterans or the patients as early as we want. Let's go ahead and do that. If you have any questions, I always avail myself to them. If they have any questions, just send me a message, email, Teams, call, whether whatever time it is. It could be in the middle of the night. Just call if it's just about this project, if it's just about this process improvement, if it's just about making sure our patients are getting relieved of this pain and other discomfort that they're having in the unit. So it's going on well. Data collection is going on well as well. And the meeting that I had with the leadership, unit leadership, and then the charge nurses was very positive. And so we are looking forward to gathering more, collecting more data, and then also making sure our implementation goes smoothly as we move along. Thank you.